You're all very familiar with heart health, brain health, and many people are even familiar with this idea of joint health. But what about metabolic health? Metabolic health is a topic that is growing in popularity, but what is it and why is it so important? Well, we have a rock star guest that we are bringing to you today to answer those questions. We're going to cue our introduction and then we're going to dive right into this conversation. Hey, welcome back, exerciser, to the Exercise is Health podcast, brought to you by Exercise for Life Studios, where we believe that your health is your most valuable asset. And the single best thing that you can do to both boost and protect this asset is exercise. Specifically, exercise is geared towards building the health and function of your muscles. We are your hosts, Charlie
and Julie.
And today we are discussing this idea of metabolic health. Like I said, many people are familiar with heart health, brain health, even joint health. But what about metabolic health? This is a topic that is growing in popularity, but admittedly, it is outside of our area of expertise. So we have a phenomenal guest that we're going to introduce you to help answer questions about metabolic health. But before we do, we have an ask for you.
There is one thing that you can do to help us out. We don't ask anything from you except for some ear space and some brain space. But if you wouldn't mind, if you've been enjoying this episode or this podcast in general, if you could pause this episode now, scroll to the bottom of your iTunes and leave us that rating and review. It really tremendously helps us in our rating, in scoring more and more amazing guests like the one we have today. But anyways, a lot of people don't realize how impactful and how important those rating and reviews are, but they are the lifeline for podcasts like this. So if you wouldn't mind, take a minute and leave us that rating and review.
So today, like we said, we're discussing this idea of metabolic health, and we have a phenomenal guest who's going to answer all of our questions about metabolic health, and that is Dr. Elie Jarrouge. Dr. Elie Jarrouge runs Metabolic Health MD, helping his patients reclaim their health and well-being through making strategic and thoughtful dietary and lifestyle choices. He specializes in the improvement of metabolic health, which has tremendous implications for more commonly known issues such as heart disease and type 2 diabetes. He attended medical school at SUNY Buffalo Jacobs School of Medicine and Biomedical Sciences and did his internal medicine residency and nephrology fellowship at Baylor College of Medicine. Well, Dr. Jarrouge, thank you so much for joining us and welcome to our show.
Thank you. Thanks for having me, Charlie.
Yes, I'm very excited to talk with you today because I know your specialty is helping your patients with their metabolic health. And so I guess I'd like to kind of start with what in the world is metabolic health? I know it's important, but how would you describe it?
I can speak for a whole day about metabolic health, but
Sure.
Generally I think about it looking from a disease perspective. Like when you look around, people are obese, have a lot of people have diabetes, high blood pressure. They're really not doing well. And when I work in the hospital, I deal with a lot of complications, heart disease, stroke, all that kind of stuff. All this kind of basically poor metabolic, where the body is not functioning correctly. So what is good metabolic? Metabolic health is really kind of multiple functions where the body, when it's working optimally, it's getting nutrients, is able to process nutrients, partition energy, store energy, use energy, manage, control blood glucose level, blood sugar level, maintain a steady weight, maintain really optimal function in different forms, a hormonal balance. So all these things, when you feel well, you're in optimal weight, and you just really don't feel like there's anything wrong with you, that's a good metabolic in generally. And that's more of what I call an insulin sensitive state, where you can basically jump between fuel sources. So we run on two types of fuel: carbohydrates, which turn to glucose, and fats turn to fatty acids. We can go back and forth. In good metabolic state, you're called metabolically flexible, so you can go back and forth. When you're metabolically unhealthy, you kind of get stuck in a carb gear where when you drop it, people get stuck. So I can dive into that, but generally that's a big overview of metabolic health. It's really just being in optimal functioning state.
Yeah, that's super interesting because I think a lot of people haven't really thought about it that way. We think about metabolism and people are like, oh yeah, I want to rev up my metabolism. I mean, they want to be able to burn more calories and stuff like that. But what you're describing reaches far beyond just kind of burning calories. Sure, burning calories may be part of it, is in terms of, like you're saying, being able to utilize glucose, being able to utilize fatty acids and everything like that, but you're talking about hormonal influences and how your body is feeling overall. Am I hearing you correctly?
Yeah, absolutely. I mean, the body is a very complicated system with a lot of redundancies. So it's
Mhm.
not going to depend on us to count calories. We wouldn't have survived through evolution.
Sure.
So it's really all the inputs, all the way that happens under the hood. There's no way to know exactly where you're. Now I'm breathing, I'm talking. I mean, my calories burning are different. My fuel source right now, I haven't eaten since yesterday, is different than if I eat a meal. So all that stuff. I mean, I'm not that good to maintain my weight at exactly the same number, but I
Sure.
don't look at calories. So it's really the body is smarter than we think.
Yeah, no, I definitely appreciate that perspective. So you brought up this idea of like, hey, metabolic flexibility, being able to utilize carbohydrates for energy, being able to utilize fat for energy. And you said when you're able to do both, you're metabolically flexible. But some people, or maybe given the amount of kind of metabolic dysfunction out there, maybe a lot of people end up not being as metabolically flexible. And you're saying that they are then burning predominantly carbohydrates, unable to use the fatty acids for energy. Can you dive into that more about like what you mean by they're only able to use carbohydrates, why that might happen, things like that?
Yeah. So the best way I can explain it. So when people are obese or overweight, you would wonder why can't they use their own body fat? Like, why do they get hungry? A lot of them don't even eat a lot, but when they crash, and it's like having granola bars around you and they're locked down. You can't access that energy. It's right there next to you, but you have a steel door blocking you from getting there. And that's insulin is the key for that. So when your insulin is high, you cannot burn fat. It's kind of a switch. So you need low insulin to turn on fat breakdown from your stores back to your bloodstream and use it as energy source. When you have a high insulin state, you're in energy storage mode. So everything you eat, carbohydrates, gets packaged. You replenish glycogen, but you also store it as fat. So almost it's a one-way valve when you have high insulin state. So people, let's say they eat a burger, they get the carbs, they get the fat, they use that, they store some of it, but 2 hours, 3 hours later, they're hungry, but they get shaky, they get hangry, they get whatever it is, everybody's different. And that's because they're stuck in high insulin state and they can't access that stores. So that's just the best way I can explain it. But over time, if you eat low carb and by the way, the statistics about 80-90% of people are metabolically unhealthy at some level. So
Wow.
so a lot of people, the obese is obvious. The one who has type 2 diabetes is obvious, but there's a lot of people who are look average, dad bod or whatever we call it, like a little bit belly. They all have different level of insulin resistance on the spectrum.
Okay.
So I think most people should assume that they're not as metabolically healthy as they should be. And that goes back to the food, which can dive into. But the goal is to really lower your insulin to allow that fat to go in reverse.
Okay, this is fascinating. So what I'm hearing you say is when your insulin levels are higher, and typically insulin is one of the things that will help like glucose go from your blood into your muscles, into your fat stores. When those insulin levels are higher, that's your body can kind of interpret that of like, well, we don't need to use fat because there's clearly carbs around, which is why our insulin levels are higher. And so because of that, we're not going to use our fat stores. And so those fat stores remain, like you were saying, kind of like locked off, like separated off, and you're not able to access those. But if you're able to get the insulin levels lower, then your body says, oh, okay, well, maybe we don't have as many carbs around as we thought. Okay, maybe we need to start using these fat stores. Now, you brought up a very interesting point that a lot of times we think, okay, well, we eat carbs and then our insulin goes up. But you're saying, well, people's insulin may actually be higher than they think, even if they're not maybe eating they're not eating like sweets and treats all the time, or they're not carrying around an extra 50, 60 pounds. They just may starting to have insulin resistance. And because of that, their body's having to produce more insulin.
Exactly. So to explain to people what insulin resistance is, think of it as I guess, pain medicine. Like the first time you take it, it works one pill. Then over time, you need 2 pills and 3 pills to have the same effect because you're constantly exposed to the drug. So insulin is essential to life. Insulin is not bad for you. Excess insulin when it's out of whack, that's really becomes the problem. So
Okay.
you need insulin to be at baseline low and use it intermittently when you have a meal, and they may have carbohydrates. And not every time you eat carbs, it means it's bad. It just kind of just the chronic, level of carbohydrates in your diet, level of insulin.
Sure.
So if your insulin running at baseline high,
Mhm.
the switch is off. You cannot access. So you need to lower it at baseline so you can
Yeah.
handle these spikes.
Okay. Yeah, that totally makes sense. It totally makes sense. Okay. So then from there, all right. So we talked about insulin resistance. I want to go more into this idea of what people can do like with their diet, because it seems like, okay, well, if we're maybe not eating as, it's necessarily like we're eating like a whole bunch of processed carbs or whatever that are spiking glucose, but yet we're still having higher levels of insulin. What kind of things are influencing that, and where does diet come into play?
Yeah, I mean, metabolic health is affected by many factors. Diet is the most important one, but also sleep, stress, all that stuff is very important. Physical activity, that's all important. But most people, you cannot outrun a bad diet. So you can sleep all you want and do all the exercise in the world, but if you're eating really bad, you're really not going to have good metabolic health. So yes, insulin resistance is like one of the big things. There's all other factors. It really goes back with what you're eating. Naturally, without going into details, junk food, anybody knows, a 5-year-old know that it's not healthy. So highly processed junk, sugars, sweets, like things in packages, things manufactured in factories, something that's not cooked at home from scratch, it's not healthy for you. And we haven't been exposed to that stuff. And the amount of sugar and carbohydrates we're getting into our body is hundreds of times more than we used to do 100 years ago. So our body hasn't been exposed to that. It's kind of in crisis. It gets inflamed, it gets damaged, it gets insulin resistant, and you see all the complications: diabetes, obesity, heart disease, you name it, cancer.
Sure. No, that's really fascinating. So one thing that I've picked up from following you on social media is the influence that like eating fewer carbs, a lower carb diet, and even going as far as like a carnivore diet can have as far as like metabolic health. Can you speak to that for a little bit?
Yeah. So every person is their own, they have their own problems. They have things they're willing to do and not do. And it depends what you're trying to fix. So you and me, like, we're probably metabolically healthy and we can tolerate things. Someone who is morbidly obese with type 2 diabetes, heart disease, they cannot, I mean, they're so much more broken metabolically speaking that they need more extreme measures. People with autoimmune diseases, although a lot of times we don't think of it as metabolic, but it is kind of inflammation, metabolic, your immune system is out of whack. So it depends what you do. So generally you want to reduce easily the like low-hanging fruit, like sugar, highly processed carbohydrates, unnecessary level of oils, and like the fake oils, the seed oils, those kind of things you want to remove from the diet and eat more whole food. I prefer animal based, but some people can go plant based. But generally, you want to prioritize real whole food. And then the degree to go all the way to carnivore depends. Again, some people have preference; they just want to go all in. It's an ultimate elimination diet. The reason carnivore works for many people is you basically eliminating all the potential culprit. At the same time, you're getting full, so you're not fighting cravings and hunger. And that's the problem with calorie restriction, is like it always requires extreme willpower to stay on it, versus if you're full, satiated, eating enough fat and protein, you actually end up eating less. If you actually count the calories, most people end up eating less calories and less frequently. And when you do that, your insulin drops, and then you unlock that fat storage, which requires a period of adjustment. That's why people quit after a week or two, because they kind of jumped into it without really doing it right, and they ran into problems and they quit.
So on that note, how would you then recommend that people maybe start to like dip their toes in the water as opposed to diving in head first and kind of going cold turkey with just eating meat?
Yeah. Well, they can do that. Some people do well on cold turkey. So the problem is that a lot of people are addicted to food, addicted to junk food. I mean, including myself, sugar. I mean, they can't moderate. So you can't tell them to eat one cookie and stop, or one.
Sure.
It's either eat the whole thing or nothing. So some people do better with a cold turkey approach. And those kind of people, I tell them just be prepared. Make sure you got to bump your protein intake up, your fat intake up, your salt intake, and expect to feel a little sluggish initially, and deal with fluid shift, electrolyte shifts. Once you get past that first week or two, it's really much easier. You just kind of trust the process. When they know what to expect, that it's not something wrong with them, then they can push through and get to the other side. Some people are too afraid to do that and they're not willing to do it. Then you can start eliminating liquid sugar like juices and sodas and candy and desserts, very quick stuff, junk food, and start modifying things, eating more whole carbs, potatoes, things like that, from the vegetable side, but not so much junk food. And
Sure.
at the same time, up the protein and just kind of move. And then as they start to feel better, they get more motivated and they can get more strict.
I love it. So it sounds like, hey, okay, step one, if you're eating to improve your metabolic health, let's cut out the processed stuff. Let's cut out like the really obvious like junk food, sugar sweetened beverages, things like that. All right, that's kind of step one. Then now you're going to be in a place where you're eating, predominantly like a whole foods diet, even if there are carbs involved as far as like potatoes and fruit and things like that. You can kind of incrementally start to cut back on those if you would like, and move towards kind of a lower and lower carb diet. If you want to go to more of the, I'm going to call it like the quote unquote extreme, using air quotes here, of more of a carnivore diet where you've cut out everything except for eating meat. Now you know that like essentially your carbohydrate intake will be, pretty much zero. And so with that, if you're at a place where you're eating lower carb, and you're eating higher protein, you're eating higher fat, the idea is that your body should then start producing less insulin. Your insulin levels should start to get lower. Is that the concept?
Absolutely. And you shift to a different metabolic state that most people in the understanding American diet don't get into, which is state of ketosis.
Okay.
And so when you're eating very low carbohydrate diet and you're still using energy, creating energy, it's all coming from fat. You start having ketones as a byproduct of that, and then that's the state of ketosis. People say ketogenic or whatever. It's really about lowering your carbohydrates very low, and that ketosis state also it has very good health benefits, from energy, feeling good, brain energy. People express mental clarity, decreased inflammation, feeling younger, all that stuff. So, but yeah, I mean, it's lowering the insulin. You're burning mainly fat. You're getting ketosis. You don't always have to be in state of ketosis. You don't even have to worry about it. But generally, if you're eating fat, doesn't have to be high fat. But if you're not eating carb, you're burning fat, and then you're in ketosis.
All right, and that's super interesting. And the other point that you brought up that I really liked is like, hey, when you're starting out, it might take, 1 week, 2 weeks for your body to be like, okay, I'm feeling better on this. Like, that's okay. That's part of the process. Yeah. Just kind of embrace that and understand that on the other side of that is kind of the metabolic health that you're seeking out, the ability to use both carbs and fat, but like you're saying, unlock those fat stores because the insulin levels will be lower.
Absolutely. And it takes time. I tell people it took you years to get to your current poor health. It's going to take you a little longer than a couple of weeks to get to the other side. And then you have to deal with the emotional issues,
your
relationship with food, binge eating, whatever. I mean, there's so many other layers to it, that people they actually have to face when they don't know they're doing that until all of a sudden they're cutting out carbs and the steak is not giving them that dopamine hit that the ice cream was doing. So.
Yeah, no, I can appreciate that for sure. So my question is from a kind of a long-term perspective. I've heard about people like cutting out carbs for, say, like, like a 6-week cut or whatever, before a fitness competition or, a show or something like that. But when we're talking kind of longer term, say like 6 months, 12 months, 2 years or more, is this kind of a feasible approach that many people can follow? I mean, obviously, like cutting out the processed stuff certainly is, but kind of going lower carb, or are there like potential risks or concerns that people should keep in mind?
People can be carnivore, can be keto all their life, and they be super healthy.
Okay.
Some people don't want to be 100% on it. They want to be more flexible. And there's a time, I mean, everybody is different, but somebody, again, if you work on your health, you reverse your type 2 diabetes, you put in remission, you come off drugs, you're in good way, you reach a good metabolic health state, then you can have a little bit more flexibility in what you can eat. Like, I mean, I'm not a hypocrite. I eat mostly meat, but I also when I go on trips, I mean, indulge in something, but I don't eat like terrible junk food. I be selective in what I choose to eat, and I do it on purpose. I don't want to stop. I mean, I get back on track. So I want people, when people think I can never, they're not going to do it. So it's about like right now, what do you need? So people need to have clarity about what they're trying to accomplish and why. Try to lose weight to look good in a swimsuit in a month from now, maybe a good short-term goal, motivating, but that's not going to make you healthy long-term. People, if they're sick or they really want to be there for their kids and family, they just don't feel good. It's a lifestyle change. This is not something that you do for a month and you go back to your old. You don't just brush your teeth once and then think it's done. You have to maintain it.
Sure.
So it's a lifestyle change, which can take months and months and a couple of years to sink in as you part of your identity. So everybody's different. Everybody has their own struggles, but it really is about knowing what you're trying to accomplish, how to accomplish it, and have a plan. And know that you're not going to always be 100%. If you fall off, just be kind to yourself, get back on track.
I love that. I love that. It makes it so practical and so like human. Like, hey, yeah, you're going to go on trips. There are going to be celebrations, and the goal is not to abstain from everything that those moments that you would find joyful. It's to be able to get your health and body to a place where you can embrace those moments and not feel like it's as detrimental to you, or it's as maybe it would be right now, or it once was. So I can definitely appreciate that. I want to go back to this idea of metabolic health, and you talked about, okay, if somebody is overweight or obese, like that may be like a very clear sign that they are metabolically unhealthy. If somebody has type 2 diabetes, that may be a sign that they are metabolically unhealthy. But you said like 80 to 90% of American adults are likely metabolically unhealthy at some level. And so the question is, okay, well, one, should everybody just assume that they're metabolically unhealthy? Because I mean, if we're talking 80 and 90%, then it's pretty much everybody. Or are there other things or signs or symptoms that people could look for and be like, okay, yeah, like this is something that I should try out?
Yeah, well, it's like you're assumed to be metabolically unhealthy until proven otherwise. In this day and age, unfortunately, it should be the other way around. But in this day and age, there's many things that without spending any money. One, you look at the mirror and you know yourself, where your body fat is. So not all body fat is created equal. Women tend to accumulate fat naturally, hormonally driven on hips and thighs, and that's completely healthy and doesn't cause any problem. It's visceral fat. What we call visceral fat is fat that is not under the skin. It's between your organs, inside your abdomen, chest, neck. So when you have central obesity, so midsection, beer belly, pot belly, whatever you want to call it, this is a type of fat that is unhealthy. That's you get fat in the liver deposit between organs and your pancreas, and it causes inflammation. It contributes to insulin resistance, and it becomes a vicious cycle. When you're insulin resistant, you need more insulin to do the same job. Your glucose has to always be normal range. Your body will do everything it needs to do to maintain that, and that's by using insulin until you reach your limit and you start developing pre-diabetes and type 2 diabetes. So that's obvious. But yeah, if you're not obviously obese, you look at your belly circumference. I like to, you measure your waist around your belly button, the biggest part of your belly, and you divide it by your height. And if you have, with the same unit, inch versus centimeter, whatever unit you use. And if you get something more than 0.5, so if I'm 5'9", so 69 inches, and if my waist is 34 and a half or more, then I'm starting to get in trouble. Like, some people get over 40-inch waist, then my ratio is coming. That means I'll have a lot of abdominal fat. That automatically means probably I'm not metabolically.
Okay.
Blood work. If you have A1C level, hemoglobin A1C, which they check for pre-diabetes or diabetes. If you have it abnormal, you automatically, you're metabolic. Triglycerides and HDL, high triglyceride, low HDL, consistent with poor metabolic health. Inflammation, there's a lab called CRP, C-reactive protein, that and also it's not high in everybody, but it's high in a lot of people. So if you have high inflammation, something going on. The most important lab that most people don't order in traditional setting is actually getting the fasting insulin level. Because your fasting insulin, again, at baseline, if you're fasting, it should be at your lowest level. But if that low level is high, then you're needing more insulin than you should. So you're probably in an insulin resistant state. There are other formulas you can calculate to create, no insulin resistance. So that's, all these things you can look at to see.
No, I appreciate that. One thing that I had heard, I don't know, it was on Instagram sometime. Somebody was saying that you mentioned HDL to triglyceride level. And they were saying, like, if you look at your HDL to triglyceride level and it's like over 1, then you may be insulin resistant. Maybe I'm screwing that up.
Yeah, I think it's triglycerides to HDL. If it's more than 2.5, which I forgot the exact number.
Okay.
Then you probably, and it doesn't mean anything by itself. It's just kind of a metric that you may have an issue.
Okay. All right. Cool.
If your triglycerides, particularly over 150, that's definitely a problem. But ideally, you want it under 100. HDL, if it's less than 40, it's usually a sign. It doesn't mean they're causing anything. It's just a marker that something is off.
Okay, cool. Well, that's that gives people like great stuff to look at. Obviously, they'd be consulting with their physician, everything like that.
Right, exactly. It's not medical advice.
Right.
And metabolic health is not one thing. You just kind of look at everything together. Blood work, look how you feel.
Sure. Yeah, absolutely. That makes a lot of sense. Does the thyroid come into play with this at all? I know a lot of times people will be like, oh, like I have a low thyroid. And so like, excessive weight gain, low energy, symptoms that may be like, oh, you're metabolically unhealthy. But how does that come into play?
Yeah, thyroid is it's a major hormone. It's kind of a master orchestrator of metabolism too. So abnormal thyroid can cause more insulin resistance, but also it goes the other way. Poor diet, poor metabolic health can cause hypothyroid, low thyroid, hypoactive thyroid. It can also cause an autoimmune form of that, which is Hashimoto's. So, and then it makes it much worse. So some people with underactive thyroid, they may have even a harder time to lose weight or reverse insulin resistance because their baseline metabolism becomes so slow that even when they're not eating much, they cannot really access their fat stores. So sometimes you have to replace the hormones, active hormones, to fix the hormonal level of thyroid and then help with the other process. But a lot of people can reverse thyroid issues by fixing their diet, whether it's carnivore, keto, low carb, fasting, and other things. They can really get to a level where they don't need the medicine.
Okay, that's awesome.
Important. And as part of the labs you check when somebody's showing up for metabolic health, thyroid function is one of the important things to check.
Now, you brought up something there that I would like to explore more, is this idea of fasting. I think, with the rise in popularity of keto, I think like intermittent fasting has also kind of gone hand in hand with that. So what is the role that fasting can play with this?
Yeah, it depends how long so if we think about it, we're supposed to be fasting or not eating as a baseline, and eating is the exception.
Yeah.
But fortunately now we're just graze from morning to evening, and we don't eat when we're sleeping. And some people wake up to eat, but even that's how bad it's become. And partly because of the advice, you got to keep your metabolism going. You need to eat frequently. And some people feel like they need to eat because they're only eating carbs, and they kind of go in this roller coaster and crashing. When you eat right, low carb, high protein, higher fat, you're not going to be hungry as much. So you end up eating less frequently. So fasting a lot of times should come naturally as a consequence of not being hungry. That's, people who are like eating super high carb, they say, oh, I can never fast. Yes, you can never fast when you're eating like that. I couldn't fast 12 hours before I did this. But now, I can fast 20 hours or longer because I'm not hungry and I ate a huge meal. I'm not asking people to do that. But basically, if you eat right, eat enough protein, you slowly gonna start become less hungry, or hungry less frequently. That's a better term. Hungry less frequently. So you may have a really good hunger, you eat a meal, you may eat another meal, and then you're good the rest of the day. So what fasting does, you allow that insulin to drop, you allow that inflammation to drop, and then because the food you ate, okay, a couple of hours, it's all either stored or used, whatever. So the rest of the time you have to get the energy from your body, and a low insulin state allows you to go that metabolic flexibility. So you switch to that. So that's with fasting. But longer fasting, some people, if you fast more than 20, 24 hours, you're going to be hungry. But there's difference between hangry and irritable, and then versus hungry, and you can manage.
Yeah.
Long fast has a lot of other properties, something called autophagy, which basically you recycle some of the old cells in your body, anti-inflammatory property, ketones. There's so many different things, anti-aging, anti-longevity. There's a lot of research around that, but most people don't need to do that. I think start eating right, fasting is going to become natural, where you easily fast 14, 16 hours a day. Some days you're not be hungry, and then you can play with it and push the fasting. Some people, you have to use fasting as a tool if they're stuck. Some do everything right, they're eating everything, but their metabolism is so broken that it really takes extreme measure, like pushing a fast 24-hour, 48, 60, 72-hour fast to really unlock that insulin and allow the body to use fat source.
That's awesome. Yeah, that's really cool. As people get older, one thing that they often say is, "Hey, the metabolism's slowing down." And their hormones may be fluctuating and everything like that. Is this approach something that can help people kind of regardless of their age, kind of helping to improve their metabolic health?
Absolutely. Of course, if you're 75, you're not going to have the same metabolism as if you're 25. But being 40, 45, 50, 55 is not an excuse to say, well, I'm getting older. It's normal to feel achy and be overweight. That's just an excuse, or they don't know. They think that because everybody's like that, they think that's part of aging. No, I think we're meant to live long and be good in good health all the way to the end before we kind of take a nosedive.
Sure.
So the idea of my age is reason. No, I work with 80-year-olds who they want to be healthy, and they eat along the same lines, and they lose weight, and metabolic profile gets better, the energy goes up, and they're very active. The oldest I'm working with is 83 years old. So it's
that's
never
awesome.
too late.
Yeah. I love that. That's fantastic. So what would you say to people who are hearing this idea of, eating lower carb, higher fat, higher protein, maybe starting to eat more meat, and they're going to be like, but what about my heart? Like, what about my heart health? Because I'm sure, that question comes up. So how would you respond to that?
Well, I have a lot of feelings about that. So the first thing I would say, an ancient food cannot be responsible for modern disease. So something we've eaten for the reason we became human is because we ate meat. You can argue some societies have less meat, more meat, basically animal protein, whether fish, meat. That's the reason we're here. And we didn't have a lot of carbohydrates. So whether we hunted and we feasted, then we didn't eat for a while. We picked some vegetables here and there, but generally we were highly dependent on animal protein and animal fat was whatever we grew seasonally. So meat is not the cause of heart disease. Red meat is not the cause of heart disease. Now there's no good study that proves any of that. First of all, any study that reports that is really what we call association study, observational study based on some people's memory of what they ate. And you can connect anything. I mean, if it rains and you find umbrellas, you can call the umbrellas as causing the rain, or fire causing fire. So just because meat existed in the meal frequently doesn't mean meat caused the problem. What else did you eat? If you eat a McDonald's, Big Mac meal, how about the bun, the fries, the seed oils, all that stuff? We're blaming that little tiny piece of patty. It's basically a plant-based diet, if you look at it, in the soda and the fries. It really has a slice of meat, and we blame that for health. So it's hard thing to let people change their mind about, because you've been bombarded about it. Every medical society tells you avoid red meat, avoid cholesterol. Although in the guidelines, like dietary cholesterol is not the cause of raising cholesterol. Actually, fasting raises your cholesterol more than anything else. A lot of people on low carb diet, which one of the hesitation by a lot of doctors to prescribe low carb keto diet is the rise in LDL, which is the bad cholesterol. It's hotly debated. There's a lot of disagreement about it, but I'm not going to get into that science, but generally we don't have to worry about that. When you will have to worry about metabolic, diabetes, obesity, high blood pressure, fatty liver. All those things are much higher risk factors for cardiovascular disease than an LDL, isolated LDL level. So you don't have to worry about that. Actually, if you want to help your heart, you remove the junk, eat more animal protein. If you don't want to eat red meat for whatever reason, that's fine. There's fish, there's chicken, there's whatever you want to eat. But generally, don't be afraid of that.
Awesome. I love it. And I think it's also interesting to note the relationship between, like you were saying, insulin resistance and heart disease. And so like if somebody is insulin resistant and consistently having higher levels of insulin, but ultimately higher levels of blood glucose, like that's going to, that can definitely be a contributing factor to heart disease. Yeah.
Because sugar is inflammatory, high insulin state is inflammatory. And heart disease is largely an inflammatory problem that your body is trying to heal by patching it up. That's how you get these plaques. But the problem is the insult never stops. So these plaques become a weapon by themselves that break off. They cause heart attacks.
Yeah, no, that totally makes sense. How also would you respond to when people say, well, any diet that recommends you completely remove a food group or completely remove a macronutrient, like that's not something that you should follow? What are your thoughts on those kind of phrases?
I think people who say that never tried it, or they don't want to quit certain foods. But when you're morbidly obese, heart disease, diabetic, whatever, you want to get healthy. And then, so we have 3 macros, right? Carbohydrates, fat, and protein. Some stuff is essential where you cannot make it. You must absolutely have it from the diet, and some things are not. Carbohydrates is one of the non-essential things. Yes, sometimes it tastes good. It's nice to have. I think we are meant to store it. Historically, we have scarcity of food. So when we ate honey, we ate carbohydrates. The body, we are designed to store it for winter. We store it quickly. But it's not essential. Your body can make glucose out of, your liver can make it out of protein, out of fat, and in different forms on an as needed basis. We only have 1 teaspoon of sugar in our bloodstream on average. So it's not a lot, and your body will make it. But there's essential fatty acids we can make ourselves. There's essential fatty acid as well. So amino acid and fatty acids. These are proteins and fats that are important. We have to eat them. If you don't eat enough protein, your cells are hormones, cells. You need building blocks to run things.
Yeah. No, I love that. That's fascinating. So, just to kind of recap, what we've talked about so far is, hey, at least here in the US, it can be safely assumed that the majority of people are somewhat metabolically unhealthy. There are some very clear telltale signs.
Yeah.
But even if you don't have those telltale signs, such as type 2 diabetes or pre-diabetes, or you're carrying around excessive weight or anything like that, just based on the nature of our society, more sedentary lifestyle, higher stress, not sleeping as well, poor food choices on average, it's likely that the majority of us are less than optimal from a metabolic health standpoint.
100%.
Choosing to at least start off by cutting out the processed foods, the refined sugars, sugar sweetened beverages, things like that, and then starting with a whole foods diet, and then from there possibly working out some of the more starchier carbs, maybe some of the higher sugar fruits, and then to a place where you're maybe eating predominantly meat or more meat or something like that, just fewer carbohydrates, can actually help to lower your insulin levels, help promote this metabolic flexibility, ability to access your fat stores and burn those fat stores. In other words, you're improving your metabolic health.
Absolutely.
Now, the thing about it is you may not need to do this for the rest of forever, because it can be seen as something like, hey, we're going to get to a place where we're more metabolically healthy than we are right now. And then we can start to introduce some stuff back in, because we'll now have built the capacity to handle those things better without it being as detrimental to our system.
Absolutely. And that's what I tell people, with the caveat, you cannot go back to what you used to eat. Like the diet that got you sick, you can't go back to eating McDonald's and candy and all that stuff, because that's what got you sick. But if you were like very low carb, but you got healthy and now you eat healthy whole food, even on an occasional junk food,
Sure,
you can get away with that. Perfectly fine. So the key is to find that balance and keep monitoring yourself to remain in optimal weight, optimal waist, optimal everything. And yeah, your body can handle a lot of stuff once you're healthy.
Yeah, I love that. I love that. Well, this is just absolutely fascinating, Dr. Jarrouge. Is there anything that I haven't asked you that I should have asked you about this discussion of metabolic health?
Yeah, people need to look in the mirror, like figuratively, and realize, like, stop making excuses for themselves. Are they healthy? Do they want to be healthier, and why? And then start doing it. Now, diet, I said, it's the most important thing, but you can't ignore other aspects like physical activity, stress, and sleep. So I've had people who eat everything right, but they have such a high stress and poor sleep that they can't lose weight. So for some people, it's 80-20 diet. Others, it's 80-20 stress or things like that. So in physical activity, if you don't have enough muscle, you're going to become less metabolically healthy. Why? Because your muscles are one of the biggest organs, and it's a big sink for sugar, glucose, and makes you insulin sensitive. So if you're skinny fat, where you look fine, but you're mostly visceral fat and very low muscle, you're going to become more insulin resistant at a much lower body fat. So you don't have a reservoir or a deep freezer, for whatever you want to call it, for being in a healthy state. So
Sure.
to stay active, stay strong, build your muscles, sleep well, because when you're not sleeping, you're insulin resistant. Cortisol from stress drive insulin resistance as well. So all these things, I think, besides your diet, you want to work on sleep, mental health, physical activity, to be kind of overall holistic.
Love it. I love it. That's fantastic. Dr. Jarrouge, where can people learn more about you? Where can they connect with you, follow your work? Absolutely.
I'm on Twitter as Elie Jarrouge, MD. And I'm on Instagram, Elie_Jarrouge. And I have a website, metabolichealthmd.com. Awesome. I work with people one-on-one for coaching, and in some states I can also get people off medications. So if they're interested in working one-on-one with me, they can always schedule a free call with me on my website.
Perfect.
They're a good fit. Yeah.
That's fantastic. You're able to work with them virtually, not just in person?
Yes, it's all virtual.
Oh, fantastic.
Yeah.
Okay, wonderful. Well, Dr. Jarrouge, a question that we like wrapping up with for all of our guests is, what is your definition of health?
Good question. So my definition of health is, I want to be able to do everything I like to do for as long as possible, and not feel like I'm restrained. I want to be pain-free, feeling good. I want metabolic. I don't want to have cardiovascular disease, cancer, all that stuff. So health is mental health and physical health. So mental health, it ties to physical health. A lot of people with anxiety, depression, whatever you call it, they improve when they eat better. So nutrients are important. So I want to focus on my physical health, but I also want to focus on my mental health, emotional health, and really just living in the moment and try to enjoy life.
Love it. I love it. Dr. Jarrouge, this was just a fascinating conversation. Thank you so much for sharing your time, your expertise with us today. This was just amazing.
Of course. Thank you, Charlie.
You bet.
Okay, that was an awesome conversation with Dr. Jarrouge. He gave so much value and so much fantastic information that we can start using and applying in our lives immediately. Hey, if you want to connect with Dr. Jarrouge, if you want to follow his work, be sure to check out his website, metabolichealthmd.com, as well as follow him on Twitter at Elie Jarrouge MD, and on Instagram at Elie_Jarrouge. We'll put all the links to all of those in the show notes below.
And if you guys have been listening to us over the last couple weeks, we have shared the most giant thing that we have changed to our website as of recent. We have rolled out a 2-week free trial to our membership because we know a lot of you guys are wanting the application of what we're talking about, how to exercise and get stronger from home without getting injured, how to not get super tight after you exercise. So we wanted to give you that trial for free as a big thank you for being a podcast follower. All you have to do to get in on your 2-week free trial is go to www.exerciseforlifestudios.com and you'll sign up right there.
So who do you know that needs to hear this episode? Who do you know who may be concerned about their metabolic health or maybe starting to experience some more common health conditions that could be related to their metabolic health? Share this episode with them so they can understand what they can start doing within their own lives and applying Dr. Jarrouge's advice into their life to start to help with that. And while you're online, head on over to Apple Podcasts and leave us a rating and review. Not only will it help people find our podcast when they're looking for information on exercise and they're looking for information on health, it will also help us get more amazing guests like Dr. Elie Jarrouge. So if you found value in the conversation we had today, let us know by leaving us a 5-star rating and review. Well, thanks so much for tuning in. We always appreciate it. Have a fantastic week, and we'll talk with you all next week. This podcast is for information purposes only. The statements and views on this podcast are not medical advice. This podcast, including Julie and Charlie Gates, disclaim responsibility for any possible adverse effects from the use of information contained herein. Opinions of guests are their own, and this podcast does not endorse or accept responsibility for statements made by guests. This podcast does not make any representations or warranties about guest qualifications or credibility. This podcast may contain paid endorsements or advertisements for products or services. Individuals on this podcast may have a direct or indirect financial interest in products or services referred to herein. If you think you have a medical issue, consult a licensed physician.